Welcome back to the Pelvic Health Summit. I'm here with Amy Stein, Doctor of Physical Therapy, a leading expert in pelvic floor dysfunction, pelvic pain. She's the past president of the International Pelvic Pain Society, as well as the author of Heal Pelvic Pain, which is her book. And Amy also sees her patients in her practice Beyond Basics Physical Therapy, where she treats men, women, and children in her 2 locations in Manhattan. Welcome.
Thank you. Thank you for having me. This is a great opportunity.
I'm excited to have you here. So let's kind of hop in. Tell us what is pelvic health and pelvic pain from your perspective as a physical therapist.
Sure. So as a physical therapist, we are experts in the musculoskeletal system. So we look at the pelvic floor, at the muscles, at the tissues, at the nerves. We do look at the organs, but not in a medical sense. We look to see how they're moving, their mobility, but we look at the body as a whole as well. Posture can play a role, different diagnoses can play a role in pelvic pain, like endometriosis, interstitial cystitis, or painful bladder syndrome, irritable bowel syndrome. All these different things can contribute to pelvic pain, or pelvic pain contributes vice versa. They can contribute to each other. So it's really important for someone that has pelvic pain to have a team, a multidisciplinary approach, because typically there is more going on than just one diagnosis.
Awesome. And can you tell us a little bit where physical therapists fit into that team, and who else might be on the team of practitioners that can support a patient with pelvic pain?
Yes. Typically what we see is that we have a physician that is familiar with pelvic pain, because not all physicians are, including gynecologists. They're not trained as well in the musculoskeletal system as physiatrists or physical therapists. But definitely having that expertise is important of a physician. Mental health provider can be extremely helpful for some that are feeling anxiety and stress. Physical therapist, pelvic floor physical therapist is key in the rehab process, because not all physical therapists treat pelvic pain. So that is an important point to know. And not all physical therapists are trained the same either to treat pelvic pain. So an interesting thing that we hear often is that physical therapy didn't work for me. Mm-hmm. And that could be because the expertise wasn't quite there with the physical therapist, or they just weren't familiar with pelvic health, pelvic floor dysfunction to begin with. Mm-hmm. And then also other things like health and wellness. So diet may be an issue with some patients, addressing the nutritional component, whether it's dietitian or nutritionist, again, that is familiar with pelvic pain and the different GI symptoms that can go along with it, as well as the fitness part, getting yourself moving, making sure you're doing some type of exercise, whether it's walking, swimming, yoga, tai chi, something to get the blood circulating, the body moving, but also not increasing any pain. So there's that fine line, and that's where the team comes in, because they could help guide you to a program that works best for you, because everyone's different. So everyone's pain is different, and one person may do well with yoga, one person may not do well with yoga. One person may be fine walking, one person may prefer to do the elliptical machine. So really getting to know the patient is important, and figuring out the right program for them.
Wow, definitely. I love how you shared that everyone's pain is different. That's so true, and finding a team that works with you is so important. Can you share a little bit more about a resource where people can find some practitioners? And I know you are the president of the International Pelvic Pain Society. Would that be a good place to start? And can you tell us a little bit more about it?
Sure. The International Pelvic Pain Society is a good place to look for a practitioner. It's pelvicpain.org. There are other organizations, the National Vulvodynia Association, the Interstitial Cystitis Association. They have Find a Provider. And then for physical therapists, Herman and Wallace Institute and the American Physical Therapy Association, Women's Health Section, they have a Find a Provider as well. But it is important to do your homework and to find out exactly what the practitioner treats, whether it is MD, DO, PT, whatever the background of the person is. It's important to do some research to make sure that they are familiar with your diagnosis. And the International Pelvic Pain Society, it's near and dear to my heart. It is a non-for-profit society. It started in 1995 with just a group of gynecologists that were meeting and trying to figure out what is going on here and why are we missing and misdiagnosing and why are these people still in pain. And that was in the 90s. And it was a small group, and now it's over 800 practitioners, which is so exciting. I've seen a lot of growth over the years. We have a scientific meeting that's in October, and that's expanded a lot too, because now we do a cadaver lab for educational purposes. We do a post-conference course. So it's really exciting to watch it grow, and it is a multidisciplinary team. So it's physicians, physical therapists, mental health care providers, and it's a great place to learn about the most updated research in pelvic pain.
Wow, that's so important and exciting. And we'll link all that information underneath this video so you can find it within the group. So tell us a little bit more about the patient journey. When a new patient comes to you, what is their experience like?
The patient journey varies quite a bit, just like their pain and symptoms can vary. We see patients, fortunately, some fairly quickly, so within 3 to 4, 4 to 5 months, that's ideal. But typically, we see them after 5 to 6, 7 years, which is, that has been researched that is the average of how patients are able to find a diagnosis and get treatment. We're hoping to decrease that number to, again, 5 to 6 months is an ideal number for when we would like to start seeing patients, because the symptoms can become more chronic the more they have the symptoms. But the positive thing is that even if we see them 5 to 7 years later, we still have had such a positive and profound impact on their symptoms. So regardless of when they come in, we have been able to help a lot of patients. My practice has been, actually we're celebrating our 15-year anniversary this year. So we've been around for a while, and since the beginning treating pelvic pain. So we've seen the progression of care and the multidisciplinary approach. And back to the patient's journey, it is varied. So some patients, it could be they had a baby and they had a tear and they're in pain and the pain hasn't gone away. Some, it could be just the symptoms have cascaded. It started with endometriosis, abdominal pain, pelvic pain. Now they have irritable bowel syndrome, bladder issues. So definitely honing in on what they're experiencing is an important part of the journey, and how to help them and how to direct them to the right practitioner. So we actually see some patients that just come in from the internet, from my book, and then what we'll do is we'll help diagnose them from a musculoskeletal perspective, and then we'll refer out to a physician, a urologist, gynecologist, whoever it may be that they need extra care from. And then we just help assist them along their healing journey.
Awesome, thank you for sharing that. So tell me a little bit more about the physical exercises that you're doing with people. Maybe we can start with a woman, and then we can also go into a man and what that physical practice looks like, and also what they're doing in the space with you, and then also what they're doing at home.
Sure. We do see a lot of men in our practice, and that's an important thing to note, because a lot of people think it's a woman's issue, but it's not. We see a lot of men with non-bacterial prostatitis, so they actually don't have an infection, but it mimics an infection. Women get similar symptoms with, they feel like they have a UTI or yeast infection, but in the end, the tests come out negative, and they actually have pelvic floor muscle dysfunction or nerve issues. So the diagnosis and treatment from a physical therapy perspective is we do the evaluation. We look at the body as a whole. We actually look at the patient walking. We look at their posture. We basically look from head to toe to see what could be influencing their pain and their symptoms. We will also assess the musculature as well as the bony alignment to see if something's off. So if something is off in, say, the sacrum, male or female, women do tend to have, it is more common with during childbearing to have more issues with the sacroiliac joint because the joints are actually expanding, allowing for the baby to make room for the baby. So we do tend to see more with the childbearing, but we see men and women with potentially a lumbar issue all the way up the spine, a sacroiliac issue, a tailbone issue. These are the ligaments that connect in the pelvis. There's a lot of them. This just shows two main ones. And then the pelvic floor muscles, which are here. Men and women have the same musculature. It's just they have different organs in that area. And if you want to see this angle, so we look at pretty much everything: the abdominal wall, the muscles of the lower extremities, as well as the pelvic floor. The pelvic floor portion is both external, the external area of the pelvic floor, but also the internal muscles. So we do assess the muscles internally, similar to like a gynecological exam or a urological exam. We also assess what the patient is doing with not only the external muscles, like are they tensing because they're in a lot of pain? Are they scrunched up in a ball because they're in a lot of pain? We see that commonly with abdominal pain syndrome, so irritable bowel, endometriosis, because the area is uncomfortable, so they tend to guard. So we're looking for that. We are looking for nerve irritation, and we're also looking to see how the muscles are functioning in the pelvic floor itself. Are they contracting when they shouldn't be contracting? Are they relaxing when they shouldn't be relaxing? More so with pain patients, they're contracting more, they're tightening, and they're guarding because of the pain. So we look at how they work with those muscles. We use biofeedback with some patients, whether it's with a machine or just through palpation or a mirror, to show them what is going on with the muscles themselves.
Cool. I haven't heard about biofeedback before. Can you elaborate?
Sure. Biofeedback it's basically just, a lot of people know biofeedback for like headaches, so what's going on in the muscles of the neck and the jaw area. That's just one form of biofeedback. And then there's also biofeedback for the pelvic floor, and we can actually see if the patient's tone, so you should have like a normal tone throughout the body where you're able to stay upright but your muscles aren't going into spasming and you're in pain. The biofeedback does allow us to see some of what's going on, but in the end it is the actual feeling of what's going on in the muscle, because biofeedback doesn't show if the muscle's physically shortened, whereas with the touch or palpation, we can actually feel what's going on with the muscle. But it is a tool that we use. There's external probes that you could use, and then there's also internal sensors that you could use to show the patient what's going on. We can use a mirror to show them what's going on in the pelvic floor area. So it's definitely a helpful tool that we use for our patients.
Definitely.
But it's only one of the many things that we do. And you did ask earlier about home program.
Mm-hmm.
That is very important, that is the first thing that I go over with patients, because it is so important for them to do whatever they can at home that will help with their pain and their symptoms. And whether it's just starting with a gentle breathing exercise, a diaphragmatic breathing, trying to relax the pelvic floor, that is one of the first things that I give pain patients or any overactive conditions. Gentle stretching, they could do at home. So my book and my video do go through gentle massages, gentle stretches, breathing exercises. Those are all things that we will give the patient usually over time, not all at once, because it also can be overwhelming. And then getting into some type of exercise routine, whether it's just walking twice a day for 10 minutes, whether it's getting in the pool and walking around a pool, using the elliptical, doing a yoga home program. So whatever works for the patient is what we try to implement.
It's awesome. So very tailored to each individual and their needs.
Yes.
So can you tell us a little bit more about common myths that you've seen associated with pelvic pain and pelvic floor dysfunction?
I mentioned one earlier, and that is that if they don't feel like they're improving with the physical therapy, or they don't feel like it's quite right, then it could be that that physical therapist doesn't have as much training, and maybe they need to get another diagnosis or another diagnosis from a physician. We've seen that before, another opinion. So that's one thing that I do want to stress, that to patients, don't give up and keep trying, keep looking for the right team that I mentioned earlier. And then also for the pain patients, so there's two different things that are typically going on in the pelvic floor. There's the overactive or hypertonic or increased tone. So almost like the muscle spasm that you get in your neck or your back, where the muscles tighten and it's painful, and you need to do more massages and a heating pad or a hot bath or hot shower. Those are one set of issues that a patient can experience with pelvic floor dysfunction. The symptoms that we hear a lot with that are abdominopelvic pain, but also bladder, bowel, urgency, frequency, retention, incomplete emptying of the bowel, so they're not, and/or bladder, so they feel like they're always full, or something like it doesn't feel quite right. They feel uncomfortable, a lot of pressure. And then there's also the sexual dysfunction that comes along with both conditions, but so for the overactive condition, it's typically more pain. Sometimes there's a hypersensitivity, sometimes there's a hyposensitivity with sexual function. So really understanding that there's a lot that can be going on with pelvic floor dysfunction, because the muscles, if I could grab my model, the muscles connect from the pubic bone in the front to the tailbone in the back, and there's a lot of muscles here. The muscles surround the urethra, bladder, the anorectal opening, as well as the genital region. So again, it could affect bladder, bowel, sexual function, and can cause pain. So there's a lot of things that can be going on in that area. And then both for men and women, and children too. We actually see bladder and bowel issues and some pain conditions with children. Then there's the other conditions, which is more the underactive pelvic floor. So that's more the weakness. That is more what people are familiar with, because they learn, people say, do Kegels, do pelvic floor exercises. For the underactive pelvic floor, which is more leaking with coughing, sneezing, laughing, lifting, jumping, then it's okay to do Kegels or pelvic floor strengthening exercise. But the overactive pelvic floor conditions, which I just went over, Kegels can actually make it worse. So that is a key myth or point that if you're going to get anything out of what we're talking about, the interview today, then that is important to know that Kegels can definitely increase symptoms because it's shortening the muscle, it's tightening the muscle more. And if you could picture having a back spasm and you're doing deadlifts with, 50-pound weight, I don't do deadlifts, so I'm not sure how much weight, but it can make the spasm worse. So it's kind of the same idea. Kegels are a contracting of the muscles, so it can actually make the overactive conditions worse. So that is one myth. Another key point is not getting constipated. That's a common thing that makes the pelvic pain or abdominal pelvic pain condition worse. Learning to control bladder habits within the comfort of your own home. We tell patients if they're going every 10 to 15 minutes to try to decrease that frequency. But if they're holding it in, that's also contraindicated. You don't want to hold it because then again, you're tightening the muscle, you're tightening or guarding the area. So definitely working with a expert pelvic floor physical therapist is key because they could teach you all these little tips and little tools that you could apply immediately at home.
Wow, thank you. That was so much amazing information. I'm learning so much. So can you tell us a little bit about patient success stories that you've had to give us a little bit of hope?
Sure. Success stories, there's a lot, fortunately. Fortunately, with men and women, there have been a lot of success stories, and it's been, again, something just like a tear, I shouldn't say just, but a tear with childbirth, a young dancer that had a hip issue that now has pelvic pain or bladder frequency urgency, to the young male, Wall Street, lots of stress and anxiety going on. He doesn't feel like he could just go to the bathroom when there's a lot of activity, so he's holding it in. There's a lot of different things. We see sexual dysfunction, so pain with sexual activity. We see males that can injure. There's injuries that occur during sexual activity that people just don't want to talk about either. So that's another important key, a myth that we should try to get rid of, that it's okay to talk about all the different diagnoses that we see. And then there's also the stories of, sorry, I'm jumping a little bit.
Jump all over the place.
Then there's also the stories that we get where they have had irritable bowel and endometriosis and Crohn's disease for years and years, and they aren't having any relief. And then they try physical therapy, and although it can't get rid of the Crohn's or irritable bowel, it can significantly reduce their symptoms. So that's a really important point to know, that a good hands-on pelvic floor physical therapist can work on the trigger points, the tight areas, can use that biofeedback to try to retrain the muscles, can give them a home program, and also make them feel empowered that they can do stuff on their own at home to help with their symptoms. So stories, I always have this interesting stories. I have a ton of stories. I'm not sure where to start, but some interesting stories. Mom, 3 kids, came to me more with urgency, frequency, some pain with intercourse with her husband, and that all improved fairly quickly because she had come soon after her 3rd child. And during the treatment, and this is way back, during the treatment she said, I don't know if this is related, but my orgasms are better from the treatment. And I said, bonus. Well, as a pelvic floor physical therapist, at the time when I started, there weren't a lot of courses being taught. So I was learning a ton from my patients. So when she said that to me, I was like, it makes sense. All the muscles are connected there. So good, great. That's awesome. So not only were her pain symptoms better, her bladder symptoms better, but also she said the best sexual activity with her husband that she'd ever had. So awesome.
That's amazing. I think so often when we're in pain, we can just see to the end of pain.
Yes.
but imagining beyond that, where there's actually an improvement from your baseline, is super inspiring.
Yes. And then I've had patients where totally fearful of getting pregnant because of their pain and unsure if they would be able to get pregnant. And we have many moms out there that we have treated with one child, multiple children, those success stories are really, really warm too, because they didn't think they could have a baby, or they were afraid to because of the pain. But lots of babies out there that we've helped along the way with the moms. And then our male patients, we've again had the gamut from the young, late teens, early 20s, had a stressful job. We taught them what to do with the bladder issues that were going on, or some say they have a lot of pain with sitting, so we'll give them cushions. That's another thing as a pelvic floor PT. We give them cushions for sitting, for the back, for whatever is going on. We can give them suggestions for home or for work. And then we've also had I think our oldest patient was 95.
Wow.
And she came in on her wheelchair, but she was totally lucid, but she just said, I have pain with sitting, and it's right in my rectum area. And we were able to help her, and we gave her a program to do at home, and we showed the nurse what to do at home to help her with her pain and symptoms. And she was totally, after even just a couple visits, and again, 95, has had this for a couple decades, and we were able to get rid of her pain. We were also able to give her tools, and her healthcare provider, the nurse at home, tools that if the pain did come back, what can you do? So that's a thing that patients have said to me over and over again, that they really appreciate, that they feel like now they could do something about their pain that has been misdiagnosed and mistreated over many years, sometimes decades.
It's super empowering. I know you were saying that obviously the sooner is better, but even if you've been dealing with pain for years, you can see improvement. So I know we have to wrap up. I could talk to you for hours. There's so much information here. So can you tell us where we can find you, where we can find more information?
Sure. We have a website, beyondbasicsphysicaltherapy.com. We have a lot of social media with a lot of good information. We have a blog, Beyond Basics PT blog. So we have a lot of great information for patients that they could use and learn from. And then also, these are both great home tools that go through a home program. So various massage techniques, breathing techniques, gentle stretches, and then also how to get back into the routine of exercise. It does not replace physical therapy or physician diagnosis or treatment, but it is a way to start doing stuff at home. Or another thing that I have patients do is, or people just in general, if they can't find a provider, I even tell them, buy my book, it's on Amazon, both are on Amazon, and take it to your healthcare provider. Show them that this is what you think is going on. If they have any ideas of where to go or who to go to, that's another thing, that's another option for areas that have less providers.
Awesome. Well, thank you so much.
Thank you. Thanks for having me. This has been a wonderful experience.
Thank you so much for joining us. Now I'd like to hear from you. Please share with us one takeaway from the interview in the comments below. Give us a like and share this group with someone who you think will benefit. Thank you.